We'll now consider waterborne Campylobacter infections. These are being increasingly recognised. Until 1978, Campylobacters were not considered to be human pathogens. Campylobacter jejuni is now recognised as the most common cause of bacterial gut infections in the developed world. Many wild birds act as a natural reservoir for these bacteria, as do domestic animals and domestic birds. Fecal material easily contaminates lakes and rivers that feed reservoirs used for drinking water. Failure of the decontamination system of these water supplies and direct fecal contamination of domestic water storage tanks has been responsible for instances of human Campylobacter infections. The problem of Campylobacter infection is compounded by the fact that in natural waters, Campylobacters undergo a transition to a viable but non-cultivable state in which they may persist for considerable periods. In experimental animals, these non-cultivable Campylobacters have been shown to cause infection. Furthermore, when symptoms of infection are manifest, the non-cultivable forms have been shown to revert to a state in which they can grow on artificial medium once more. Now let's think about waterborne virus infections. Hepatitis A virus, an RNA virus of the picornavirus family, causes acute infective hepatitis, resulting in inflammation of the liver. This is in contrast to serum hepatitis caused by the hepatitis B virus, a DNA virus, and also other forms of hepatitis. Infective hepatitis is also known as acute epidemic hepatitis, reflecting the sudden onset of symptoms in this generally self-limiting disease that frequently occurs in epidemics. In the early stages of the disease, patients complain of fatigue, fever, diarrhea, malaise, and a loss of appetite, or anorexia. In about 2/3 of adult patients, this so-called pre-icteric phase, or before jaundice, appears, is followed by a period of jaundice that lasts for 1 to 3 weeks. Patients generally feel better once the jaundice develops. In contrast to adults, only about 1 in 12 children infected with hepatitis A show any clinical evidence of jaundice. This disease is most often seen in children and young adults and is more common in institutions where large numbers of people live in close proximity, such as in military barracks or in boarding school dormitories. The infection spreads via the fecal-oral route, and water is a common vector of hepatitis A infection. The virus first replicates in the epithelium of the gut, from whence the virus particles enter the bloodstream. They are thus transported to the liver, where they replicate, causing inflammation. Large numbers of virus particles are shed into the bile duct, where they regain access to the lumen of the gut. The feces of patients with hepatitis A are highly infectious. Polio Myelitis is caused by the polio virus, another RNA virus that belongs to the enterovirus family. This virus can replicate in the oropharynx or in the small intestine. Virus particles may be shed in droplets found in the nasal cavities and in the throat discharges, and so they can be transmitted by the respiratory route. However, infected feces are also a significant source of human poliovirus infection, and with water contaminated with feces, this is an important vector for the disease. After initial infection of the mucosa of the oropharynx or small intestine, the virus replicates and spreads to local lymphoid tissues, particularly the tonsils in the throat, and Peyer's patches and lymph nodes in the abdomen. From there, the virus enters the bloodstream to cause a transient viremia, where virus particles circulate in the bloodstream and get carried around the body. Even people vaccinated with a live attenuated Sabine vaccine experience a viremia. During the initial phase of the disease, patients suffer a fever, sore throat, anorexia, and a headache. In most cases, the disease does not develop further than this. These cases are sometimes referred to as abortive poliomyelitis. In about 5% of cases, patients progress to develop aseptic meningitis. This lasts from 2 to 10 days. A tiny minority of patients, about 0.1%, develop paralytic poliomyelitis. Virus particles spread along the nerve fibres to the central nervous system, primarily attacking motor neurons. The obvious muscle wasting that is evident in patients with paralytic poliomyelitis does not result from the direct damage of the muscle cells by the poliovirus. Rather, it is a secondary consequence of the damage to the motor neurons. Now, let's consider waterborne protist diseases. The cause of amoebic dysentery is Entamoeba histolytica. A common source of this condition is consumption of contaminated water. As with other waterborne infections, this may not necessarily be as a result of drinking dirty water. There are many people worldwide who carry Entamoeba histolytica asymptomatically, and it has not been established yet whether all strains have the capacity to cause disease. In patients who do develop symptoms, the disease has more insidious onset than does bacillary dysentery. The condition is characterized by abdominal pain and cramps with diarrhea. Blood and pus, together with mucus, are present in the stools of the affected patients. A milder form of the disease sees alternating phases of diarrhea and constipation. The amoebae invade the mucosa of the intestine, causing multiple abscess formation. The presence of pus in the stools probably results from secondary bacterial infection of sites already infected by amoebae. Rare complications of Entamoeba histolytica infections include liver abscesses and amoebic pneumonia. Liver abscesses associated with amoebic dysentery are sometimes described as resembling anchovy paste. Giardia intestinalis, also known as Giardia lamblia, causes infection of the upper portion of the lower respiratory tract. There, the protozoa cause chronic malabsorption, and so patients pass loose, foul-smelling, fatty stools. Giardia infections are characterized by diarrhea, abdominal cramps, weight loss, and anemia. In the United Kingdom, the illness is seen especially in young children attending daycare facilities. It is also common for travellers returning from holidays in the Himalayas and from cities of the former Soviet Union, where the water supplies of several cities appear to be chronically contaminated with this protist. Balantidium coli is a protist often seen as a commensal of the human intestine. It is also frequently found in the intestines of pigs, but it is increasingly being recognised as a rare cause of a dysenteric-like illness in humans. Particularly infected are people who drink water contaminated with the faeces of pigs. Cryptosporidium parvum is a protist that is frequently isolated from cattle. Several Cryptosporidia are associated with sheep, and yet more can be isolated from birds. Like Balantidium coli, it is now being recognised as a significant cause of human diarrheal disease. Some people may be asymptomatic carriers. In others, it causes diarrhea. Epidemics of cryptosporidiosis have been attributed to the failure of domestic water purification systems. Severe, long-term diarrhea caused by cryptosporidia is one of the commonest presenting symptoms in patients with AIDS, although it can cause severe disease in anyone whose immune system isn't functioning effectively for whatever reason.